Space Vision, developing a game for vision screening and home-based monitoring. As a consequence of recent pressures, the UK National Health Service must urgently address an unsustainable backlog of appointments within the system's busiest department, ophthalmology. It is vital to find new ways to prioritise patients, automate routine aspects of eye care and reduce unnecessary appointments. Paediatric eye care is a significant financial burden on the system which could particularly benefit from greater efficiency and better treatment adherence. Together, Occo Health and the University of Bristol have been exploring serious games to facilitate more accurate vision screening and to motivate children to take a more proactive role in condition monitoring. Our first goal is to support childhood amblyopia, a condition that affects 1 in 50 children. While amblyopia can be reversed if diagnosed and treated between the ages of 2 to 8 years, treatment challenges can cause variable outcomes. These challenges include, firstly, the long treatment pathway of up to 18 months, which includes daily patching activities, whereby a child's good eye is covered with a patch, forcing them to use and improve the functionality of the amblyopic eye. As patching often occurs for several hours per day, this can be an unpleasant experience. Secondly, measurements are undertaken every 6 weeks in clinic, but more frequent data points would better inform treatment decision-making. Finally, current clinical paediatric assessments often struggle to engage children for long enough to produce accurate results, particularly when repeated. In our paper, we introduce and evaluate an early prototype of our first serious game for diagnosing and monitoring amblyopia, Space Vision. Space Vision is a hidden object game for tablet devices that uses vanishing optotypes to measure visual acuity, a critical marker of visual function. The game presents black and white square optotypes in each of 4 screen quadrants, progressively fading into the background over a series of test trials. Players touch the screen to select a visible optotype, indicating that they can see it before another is presented. To ensure clinical accuracy, optotypes are presented at a set distance between the patient and their device. To measure this, the front-facing camera maintains a connection with a fiducial point of reference marker affixed over the eye to be tested and secured onto a pair of glasses. As an early proof-of-concept game concentrating on children towards the bottom to middle of the 2 to 8 year age demographic, Space Vision included only very simple elements of game design. The game's story is framed around the player flying through the galaxy on a spaceship in order to find and rescue aliens that have become lost. This is explained during the narrative preamble. During testing games, upon tapping an optotype, different aliens appear from behind the checkered boxes, performing novel, humorous animations for the player. The game was initially designed as a gamified within-clinic tool that could replace traditional forms of pre-literate children's visual acuity assessment through greater engagement of children. However, feedback from partnering clinicians suggested that the game would be more valuable to inform treatment decisions and patient prioritisation if it could also be used within home monitoring settings. While our earlier work had confirmed Space Vision's efficacy in measuring visual acuity similar to a traditional acuity test, it was unclear the extent to which it could support the repeated long-term play required for monitoring use. We needed to understand the value of the very limited elements of the game design involved, the story narrative and animation, and the intended humour from the character personalities, as well as identify our creative direction. We also didn't know how self-directed the game could be for players in home environments without supervised clinical support in terms of the physical interactions with the tablet devices. Using an early prototype with 13 school children aged 5 to 6 years, we investigated player experiences through a series of design and evaluation sessions involving one-to-one observational playtests, semi-structured interviews, and an ideation activity with each child. Here are some of our takeaways. Firstly, although mapping the hidden object game mechanic closely to the underlying visual acuity test promoted its theoretical efficacy, the lack of integration of engagement within gameplay beyond character animations alone would not facilitate testing for monitoring purposes. There needed to be greater incentivisation for playing the game correctly. The players struggled to maintain the connection between the fiducial marker and the glasses and did not correct their behaviour without research or intervention. There was also a desire for greater self-congruence between the characters, narratives, and the players. Character behaviours and values, and story features and challenges should reflect the player's own lives. Finally, character engagement may be increased by supporting player fantasy through superpowers and costumes, particularly relevant to this age group, in order to provide novel variations upon the same underlying hidden object mechanic improving replayability beyond a single session. Here we have some of the example contributions from the children, reflecting some of the fantasy themes and storylines to be represented in the next version of the game. You can see how the original characters have been edited to grant children a customizable choice over their appearance and capabilities. We now have a rainbow-powered space rabbit that's able to fly outside the spaceship to conduct death-defying rescues, a vampire-themed character with X-ray vision to help see aliens in danger from a distance, and an alien with a spacesuit and rocket boots that is now better equipped for the elements. Meanwhile, the narrative suggested not only included space, but were also present closer to home, helping peers and family members, standing up for good against evil, and practicing good manners at home and at school. Please read our paper for a more complete overview of the insights generated from this work. If you'd like to contact me, please feel free to do so.